Imagine waking up in the middle of the night because someone in your family is screaming at the darkness, not shouting at a person, not shouting at an animal, shouting at something nobody else can see. He says there are voices in the cave mouth. He says the air is speaking. He says your dead grandfather is standing by the fire and won't stop pointing at him. He hasn't slept in days. He won't eat. He flinches when anyone touches him. He laughs at nothing. Then he cries for an hour. Then he swears he can hear the sky grinding. Now imagine this is happening 6,000 years ago. There is no word for schizophrenia, no antidepressants, no diagnosis, no hospital intake form, no therapist with soft lighting, and a bookshelf full of boundary-setting literature. What you have is a frightened family, a tribe that needs stability, and somebody in the group who is no longer behaving like the group understands a human being should behave. And that is where this story begins. Because when we ask what ancient humans really did to the mentally ill, what we're really asking is something much bigger and much more uncomfortable. We are asking what human beings do when another human mind stops making familiar sense. Do we fear it, worship it, punish it, heal it, hide it, include it, turn it into spectacle, turn it into sin, turn it into medicine? The answer across history is yes, all of the above, sometimes all at once. And the truth is a lot stranger than the easy version people like to tell, because the ancient world was not just one long horror movie of superstition and cruelty. It was also a world of improvisation, empathy, ritual, guesswork, observation, and occasionally, shockingly, compassion. Not enough compassion, not consistent compassion, but enough to ruin the simple story. Let's start before written history, because the very first hard evidence we have is already absolutely unhe. Nangshti archaeologists have found prehistoric skulls with neat holes cut into them, not smashed in battle, not cracked by accident, deliberately opened. Some of these skulls show bone healing around the edges, which means the person survived. They lived long enough for the bone to begin growing back, which means somebody at some point restrained or assisted a living human being, took a tool to their skull, and made an opening on purpose. This is trepanation, and it is one of the oldest surgical procedures on Earth. Why did they do it? Sometimes probably for head trauma, sometimes maybe for pressure after injury, but in many cases, historians think the reason was spiritual. Something was wrong inside the person, and the something needed a way out. If a man was hearing voices, shaking, collapsing, raging, or acting in ways the group could not explain, one answer available to very early humans was brutally simple. There is a hostile force in the head. Open the head, release the force. I need you to appreciate the level of confidence required for that solution. Your cousin hasn't slept in 10 days and is whispering to the moon. Diagnosis: demon, treatment, skull ventilation. And yes, that sounds absurd to us, but here is the disturbing part. Trepanation appears in multiple cultures separated by geography and time. Prehistoric Europe, the Andes, parts of Africa, later classical and medieval settings too. Different peoples, different languages, different gods, all independently circling the same deeply alarming idea that if the mind is broken, perhaps the skull is the door. That either tells you something profound about the universal human need to explain mental suffering, or it tells you that our species has always had a terrifying amount of confidence while knowing almost nothing, probably both. Then we arrive in Mesopotamia, and this is where mental illness becomes not just a social problem but a cosmic one. In ancient Babylon and Assyria, suffering of the mind was often understood through the logic of divine punishment and supernatural attack. Illness could be described as the hand of a god, ghost, or demon, the hand of Shamash, the hand of Ishtar, the hand of some offended force reaching down into your life and pressing on your brain like a debt collector from the heavens. Which, to be fair, if you've ever had an anxiety spiral so bad it felt physically heavy, the phrase "something pressing down on me" does have a weird amount of poetic accuracy. Mesopotamians had healers who worked in overlapping ways. There were practical healers using remedies, and ritual experts using incantations, prayers, and protective rites. If someone's behavior became erratic, terrifying, or incomprehensible, the response might involve both medicine and magic, because for them, those categories were not cleanly separated. A person's nightmares, convulsions, panic, despair, and confusion were symptoms, yes, but also clues in a spiritual investigation. They were trying to answer questions that still haunt medicine now, just in a different language. Why this person? Why now? What caused it? Can it be reversed? Did someone fail them? Did they fail somehow? And before we get smug, we should notice something important. Mesopotamian healers observed carefully. Their texts recorded symptoms in detail. They noticed patterns. They were not stupid. They were working with a faulty model of causation, not a lack of intelligence. Which is a useful historical reminder, because having a confident explanation and having a correct explanation are two wildly different achievements. Egypt complicates the story even more, because ancient Egypt was often less purely supernatural than people assume. Egyptian medicine still blended ritual and healing, absolutely. Magic was there, priests were there, spiritual framework, archaists were there. But Egyptian medical texts also treated disturbances of mood and mind as part of the broader landscape of illness. Mental and physical suffering were not sharply divided. The person was one system, the body, the emotions, the heart, the spirit, the social world, all tangled together. There are references in Egyptian tradition to states that sound remarkably like despondency, emotional disturbance, and inner turmoil. There were herbal remedies, dream interpretation, temple healing, and even forms of emotional catharsis. Some traditions involved patients expressing troubles in writing, almost like ancient grief processing with a metaphysical mailing address. Imagine being told that your treatment plan is rest, ritual, calming surroundings, interpreted dreams, herbal medicine, and a chance to unload your suffering into language. That is not modern psychiatry. But it is not nothing. It is not simply burn the witch, either. Egypt understood something that advanced civilizations keep forgetting and then rediscovering like idiots every few centuries. The environment around a suffering mind matters. Rest matters. Sound matters. Meaning matters. Community matters. The stories a patient tells matter. Were they anatomically right? Not especially. They linked things to the heart in ways that would not impress a neurologist. But they were at least standing in the right philosophical neighborhood. They were looking at the distressed person and saying this condition belongs to the field of care. That distinction matters more than it sounds. Then Greece arrives and makes everything simultaneously smarter and more annoying. Ancient Greece gave the world two competing ideas about mental disturbance, and both of them had enormous consequences. The first was the divine model. Madness might be punishment, but it might also be revelation. Altered states were not always seen as degradation. Sometimes they were treated as access. The oracle is not normal, the prophet is not stable in the everyday sense. The poet seized by inspiration is not exactly presenting as emotionally regulated. Plato talked about forms of divine madness that could be superior to ordinary rational consciousness, which is one of the most Greek things imaginable. Take a terrifying human condition and immediately turn it into a philosophical debate about whether the gods are using you as premium content. This matters because it means not every ancient society saw unusual mental states as merely shameful. Sometimes the disturbed person was frightening, yes, but sometimes they were also set apart, invested with awe, suspicion, or sacred ambiguity. The same behavior that gets you ostracized in one village might get you interpreted as chosen in another. And that sounds romantic until you remember that being treated as holy can still be a form of not being treated as a person. It is just exile with nicer branding. Then there was the second Greek model, the medical one. Hippocratic writers argued that diseases had natural causes, not divine ones. In the case of the so-called sacred disease, epilepsy, the claim was revolutionary. This was not a god entering the body. This was a disorder with physical causes. Something in the human organism was going wrong. That same intellectual shift opened the door to thinking about disturbances of thought, emotion, and behavior as bodily problems rather than supernatural verdicts. Was the Greek humoral theory correct? No. Blood, phlegm, yellow bile, black bile, none of that is surviving peer review. But the deeper move was huge. The move was this: what if mental suffering is part of nature? What if it belongs to medicine? What if the person is not cursed, but ill? That is one of the most important shifts in the history of humanity, and it is also humbling because the world did not immediately accept it. Of course it didn't. Humans do not gracefully abandon emotionally satisfying explanations just because a better one shows up with evidence. Rome inherited Greek ideas and then did the Roman thing to them, which is to formalize them, practicalize them, and occasionally weaponize them. Roman physicians continued humoral medicine and recommended baths, diet, exercise, and conversation. Yes, conversation. The stories distressed people told about themselves were considered relevant to treatment. Again, not psychotherapy in the modern sense, but enough to notice the outline from a distance. A physician listening to your distress as part of care is not a small thing. But Rome also reminds us that once a society creates a category for mental incapacity, that category can be abused. A family member judged mad could lose control over property and legal standing. Guardianship could protect, but it could also dispossess. If someone was truly floridly psychotic, incapable of managing life, intervention might save them. If someone was inconvenient, embarrassing, or rich, the exact same legal machinery might start to look very attractive to the relatives circling the estate like well-dressed vultures. That is the dark pattern that repeats for centuries. The moment a civilization says, "We have identified the unstable person," it becomes possible both to help them and to strip them of power. History is full of people doing both with the same vocabulary. And if you think that is just an ancient problem, I have terrible news about the entire rest of human history. Now here is where the story usually gets flattened into a cartoon. People say the ancient world was superstitious, then the modern world became scientific, and that was the end of that. Clean progress, upward line, ignorance out, reason in. That is not what happened. The medieval period, for example, is a mess in the most historically annoying way possible. There were absolutely exorcisms, demonologies, punishments, confinements, fears of possession, and brutal treatments. Anyone trying to tell you otherwise is laundering history. But it is also true that medieval Islamic medicine preserved, expanded, and systematized medical approaches to mental suffering in ways that were genuinely ahead of their time. Physicians like Avicenna discussed mental disturbances medically. Hospitals in the Islamic world treated mental as well as physical illness. Music, baths, routine, supervised care, and structured institutions appear here in ways that make the simple "everyone before modern Europe was barbaric" narrative collapse on contact. That matters because history is constantly being rewritten into a comforting myth where the people we already expect to be enlightened become the heroes by default. Real history is ruder than that. Compassion and cruelty do not obey modern branding. They appear in civilizations unevenly, embarrassingly, unpredictably. Even medieval Christian Europe, which absolutely had strong possession frameworks, was not one uniform block of sadism. Some communities simply folded the disturbed into daily life if they were not violent. They were watched, fed, known, tolerated, sometimes pitied, sometimes mocked, but not always expelled. That is not clinical care, it is not cure. But inclusion, even imperfect inclusion, is historically rarer and more valuable than it sounds. Then you get places like Geel in Belgium, where a long tradition developed of mentally ill people living with local families and participating in communal life. That model survives because it was built on a premise that still feels radical in every century. The person who is mentally unwell is still a person, and personhood does not disappear when behavior becomes strange. Then Europe builds institutions at scale and everything becomes more efficient and less humane, which is a very human combination. By the early modern period, confinement expands. The mad, the poor, the disruptive, the abandoned, the socially inconvenient, all start getting sorted into spaces designed as much for public order as for care. Bethlehem in London becomes infamous not just because conditions were harsh, but because the public could come and look. Mental suffering became spectacle, a day out, a ticketed encounter with someone else's shattered mind. There is something so darkly perfect about that. First, societies fear the mentally ill, then they pathologize them, then they cage them, then they sell tickets. If you ever want a single image for how fragile civilization's moral self-image really is, there it is. And yet, even here, the story still refuses to stay simple. Reformers emerge, Some physicians and religious communities argue that chains, beatings, isolation, and humiliation are not treatment, that kindness, work, air, routine, and dignity produce better outcomes, which sounds obvious to us because it is obvious. But history is full of truths that are obvious only after somebody suffers for centuries first. What I want you to notice across all of this is not merely the weird treatments. It is the recurring logic beneath them. When ancient humans encountered mental disturbance, they usually did one of five things. They spiritualized it, they medicalized it, they ritualized it, they isolated it, or they absorbed it into community life. Sometimes the exact same society did several at once. That is the real story. Not one linear progression from stupidity to enlightenment, more like a constant argument between fear and care, between explanation and control, between what is wrong with this person and what do we owe this person. And third, that second question is the one history never fully solves, because once you look closely, a disturbing pattern emerges. The most sophisticated explanation was not always paired with the most humane treatment. A society could have brilliant theories and still be cruel. Another could have wildly inaccurate beliefs and still manage somehow to be gentler in practice. Mesopotamia had supernatural explanations but sincere healers. Greece had philosophy and medicine but also stigma and ambiguity. Rome had law and order and also easy pathways to dispossession. Medieval Islamic hospitals could offer structured humane care while other societies leaned harder into possession and punishment. European institutions later called themselves rational while reducing people to spectacle. Knowledge helps. Of course it helps. Better science matters. Accurate diagnosis matters. Effective treatment matters. But history keeps pounding on the same locked door with the same message. Knowledge alone does not make people kind. A civilization can understand a disorder and still fail the sufferer. That may actually be the oldest lesson in the entire history of mental illness. So what did ancient humans really do to the mentally ill? Sometimes they drilled into their skulls, sometimes they called them cursed, sometimes chosen, sometimes dangerous, sometimes sick, sometimes burdens, sometimes vessels of the divine, sometimes patients, sometimes legal problems, sometimes neighbors. And every one of those labels came with consequences. Some of those consequences were horrifying. Some were bizarre. Some were thoughtful in the wrong framework. Some were genuinely humane. Most were unstable mixtures of all four. And if that answer feels unsatisfying, good. It should. Because tidy history is usually dishonest history. The deeper truth is that societies have always revealed themselves in how they treat people whose minds make everyone else uncomfortable. Not just Jesus. What theories they invent, but what they actually do when faced with fear, unpredictability, dependency, and difference. Do they protect? Do they punish? Do they hide? Do they listen? Do they turn suffering into a moral failure? Do they turn confusion into entertainment? Do they make room? That was the question in a prehistoric camp. It was the question in a Mesopotamian ritual chamber. It was the question in an Egyptian healing space. It was the question in Greek medicine, Roman law, medieval hospitals, village households, and institutional wards. It is still the question now. Because for all our neuroscience, pharmacology, psychiatry, legal protections, awareness campaigns, and carefully branded conversations about mental health, the oldest conflict has not gone away. We still oscillate between empathy and fear. We still romanticize some kinds of suffering, criminalize others, neglect plenty, and medicalize almost all of it while quietly deciding who is easy to care about and who is too disruptive to fit the picture. That is why this history matters. Not because it lets us laugh at ancient people for believing in demons. Honestly, that part is too easy. The useful part is realizing how often human beings have used whatever language was available: demons, humors, sin, madness, diagnosis, risk, liability, noncompliance, deviance, to create distance between themselves and the person in distress. Distance is the oldest treatment plan on Earth, and every meaningful reform in the history of mental illness has started by reducing that distance, by moving one step closer, by saying no, This person is not merely cursed or embarrassing or economically inconvenient or theatrically frightening or spiritually contaminated. This person is suffering. Start there. That is the line that separates the worst chapters of this history from the best ones. Not science versus soupy. Restition. Not ancient versus modern. Not east versus west. Not civilized versus primitive. The real divide is simpler and harder than that. It is whether a society looks at a disturbed human being and sees a problem to remove or a person to care for. Ancient humans answered that question in every way imaginable, sometimes with horror, sometimes with ritual, sometimes with surprising tenderness, usually with contradiction. And maybe that is the most honest answer of all. Because the history of mental illness is not really the history of how people explain strange behavior. It is the history of how much discomfort other people were willing to bear in order to keep the sufferer inside the circle of human concern. That has always been the test. Not whether you can explain the mind, whether you can stay humane when the mind becomes difficult to understand. That was hard for them. It is hard for us. And if we are being completely honest, that is probably the one part of this story that has never changed.